Morning. Thank you for having me. Let's see. We just heard about the triple aim, and I'm going to briefly mention the triple A and see if I talk about it and cover it during my talk. That's adaptive, algorithmic, asynchronous care. All right, I'm going to start with the story of Kate. So Kate is a 34-year-old woman. She's a mother of two. She's a busy mom. She works full-time. And she wakes up this morning with a headache and sinus pressure. And she's had a sinus infection before, and that's what she thinks she has. She realizes she's had this cold for 2 weeks. And yesterday she tried to call her doctor's office to get in to be seen, but they told her she could have an appointment in a week. So today she thinks about going to urgent care, and she realizes with the parking and the driving and getting her kids to daycare and missing work, it's going to take about 3 hours, and she doesn't want to go in. What she wants is to get convenient medical care without a lot of hassle. And there's the gap. So Zipnosis was founded in 2008 to address the gap in mobile health while focusing on clinical efficiency and adherence to evidence-based guidelines. What we do is transform how patients and providers connect for care, and we do so staying grounded in evidence-based medicine. We started essentially as a minute clinic on your iPhone. So if you're from out of the country, Minute Clinics is a retail health where you'd go to treat minor urgent care conditions, like a bladder infection or a sinus infection. And now we have more than 90 clinical conditions that we can treat based on algorithms with online care. We sell our software as a service to health systems. We are now in 20 health systems across the country. And last year, in 2016, we had over 20,000 completed visits. If you start getting care online, you will probably start with an adaptive online interview. So that's a series of questions that evolves as you answer the questions about your clinical condition. And most people can be treated for these minor urgent care conditions online, but some will need to progress to a phone call and some to a video. Sometimes you still need to go in to get treatment, and our smart triage system refers you into the right level of care. Really, in medicine, there are multiple gaps, and two other gaps are clinical efficiency and adherence to evidence-based standards. Here's one example of how we address the clinical efficiency. So on the right, you see the questions that a patient might answer. Here's an example of a bladder infection, and they're just the questions that a patient would answer if their doctor were asking them about their bladder infection. And on the other side, you see the clinical note that is automatically generated for the clinician. So on our platform, we say that after you do your adaptive interview, you will get care within an hour, and really our average is 10 minutes that the clinicians will answer. And they will answer with an automatically generated note to the patient with automatic clinical documentation for the clinician. So as an aside, a recent study showed that doctors spend 50% of their day typing, clerical work essentially, not on our platform, however. I did a recent study looking at how much time clinicians spend with their patients and doing documentation for an in-person family practice visit, 21 minutes, compared to the time that a doctor will spend on our platform taking care of the patient and doing the documentation, 1.4 minutes. So that's 21 minutes for in-person care of a doctor's time versus 1.4 minutes. We also address the adherence to evidence-based guidelines. So if a patient follows our clinical pathway down a protocol following the algorithm, the clinician will get a very curated list of possible diagnoses and treatment options. And the treatment options will be with the first-line antibiotics, second-line antibiotics, and it is clear if they do not need antibiotics. So our adherence to evidence-based guideline is really easy for the clinicians in the platform. In the same study that I just mentioned, we looked at family practice docs in clinics and found that they had a 56% adherence to evidence-based guidelines, and in our platform it was greater than 95%. So that's 56% in person, 95% on our platform. This makes prescriptions very judiciously dispensed, and antibiotic stewardship is guarded quite carefully. Let me just mention our prescription capabilities for a moment. We have the doctor get the curated list of diagnoses and treatment options. If they decide that a prescription is indicated, they can okay a prescription. It comes back to the patient online, and the patient will go ahead and fill it themselves. They'll get a geolocated list of pharmacies for where they are. They will click on the pharmacy that's convenient for them that day, and the prescription, through a very novel partnership with SureScripts, will go directly to that pharmacy. Let me just define for a minute asynchronous care versus synchronous care in case you're not familiar with it. Asynchronous care is care that's not in the same time. So our adaptive online interview that a patient will fill out and then a clinician will review 10 minutes later is asynchronous. Synchronous care would be getting care over the phone or video or in person, care that's in the same time. And really the efficient nature of the Zipnosis platform comes from the asynchronous care. And we've done some market research, which won't surprise you, but the younger generations actually prefer online care or asynchronous care compared to synchronous care. We've also found that healthcare within your own system and with your doctor is preferable to completely unrelated care where the records never make it into your healthcare system. So we work with our partner health systems to make sure that your records are integrated, your doctor can look them up and find them. We also have single sign-on both in the patient portal and for the clinician. We can integrate into online clinic scheduling. So if you are potentially triaged out for your visit, you can go directly just to schedule for the next available appointment, making care as convenient and accessible for patients as possible. At some point, however, patients will need to go into the clinic for care or for testing, and that's the Zip ticket, which I think is really our most innovative product. The Zip ticket's essentially a fast pass for getting healthcare online. So in person. As much as we'd like to have most care online, we know that there's certainly times when you need to go into the clinic for care. And the Zip ticket is our fast boarding pass. So for example, if you are doing a visit for strep throat and it becomes clear that you meet the center score criteria for strep throat and you need to go in for a strep test, our fast pass will help you get in. This is one way where we're differentiated from some of the video medicine that's going on, is because we will not prescribe a antibiotic for strep throat without a strep test. Evidence-based guidelines say you need a strep test, and this is the way that will make it fast and easy. We also have very good data documentation. Statnosis is our data tool where health systems get up-to-the-minute data about the visits that are coming in on their online platform. And we can look at this to analyze and get a lot of structured data and information back. For example, if you have a bladder infection and you're answering the questions about a bladder infection, you go down the protocol and you indicate that you have fever and chills and back pain, then you need to be seen in person in clinic for a potential kidney infection. And we can track all of those triaged out questions and see at what percentages people triage out. And it's also a way for us to improve our platform to see if indeed those people had ended up with infections that they needed to go in to be seen in person for. So Zipnosis addresses the gap in mobile health while paying attention to clinical efficiency and following evidence-based guidelines. I will just add as a final note that there's currently a lot of telemedicine via video, but with the capabilities we have for asynchronous, adaptive, algorithmic care, our CEO likes to say, when was the last time you bought a book over video from Amazon? This is the way that's coming. Thank you.
So second lightning talk speaker for the day is Dr. Samit Gupta, who's the founder and CEO of Graftworx. That's a company that specializes in wearables and implantables on an integrated sensor platform. Welcome, Samit.
Hi, and I'll apologize in advance. I'm fighting a bit of a cold, so please bear with me. I have seen a doctor. I'm not dying, so don't worry if it sounds bad. So hi, my name is Samit. I'm one of the founders and actually Chief Technology Officer at Graftworx. We're a team of 25 people, and we're committed to changing cardiovascular medicine through sensors and software. When we started the company about 5 years ago, my co-founder Dave was a student in medical school, and I was looking for my next project after my first company had been acquired by Johnson & Johnson. So Dave really came up with the inspiration for this. He was on a vascular surgery rotation, and as part of his rotation, his predominant role there was to act as the liaison between the ER and the vascular surgeons if any emergency cases came in. And more often than not, people would walk in with a blue foot, a blue leg, and that was usually the result of a failed vascular implant. And those patients would literally walk into the hospital and they would go home in a wheelchair because they would have to have an amputation. So Dave looked at this and he thought, how can we make that better? Well, to add to that, most of those patients could have actually gotten treatment through a minimally invasive outpatient procedure if the clinician had gotten alerted earlier. So these patients were coming in when their implants were 100% stenosed or fully thrombosed. If the clinician had gotten an alert at 75%, 80, even 85% stenosed, we could have saved their leg. So Dave looked at this and he said, here's a great opportunity to improve patient life, to improve the clinical workflow, and also provide value across the healthcare chain. So that's when he made the decision, totally not risky at all, to quit medical school and start Graftworx. So after he made the decision, he called me up and he says, hey, you're out in the Bay Area. Can I come over to your place, crash there for a couple of weeks to work on an idea? I've known Dave for over 20 years. So the first thing I did was I asked my wife. And she said, it's fine as long as it sleeps on the couch and as long as it's only a couple of weeks. As you can probably guess, it was a lot longer than a couple of weeks. But we had a good time. He was really good at cooking and cleaning, and he really made up for it. But when he wasn't busy with that, we threw ourselves into this problem. We had no technology when we started out. We went dumpster diving for our first set of lab equipment. We were repurposing hobbyist electronic kits off of SparkFun. I mean, we went through obstacle after obstacle after obstacle to get to that very first prototype to prove that we could demonstrate a reliable, scalable way to detect 75% stenosis inside of a vessel. And we did it. After 2 months, we were off to the races talking to major strategics in the space, from people in the cardiovascular space to people in the healthcare system space. So basically, when I look back at that time, we were able to demonstrate what you're looking up at the slide here. And it's kind of a crazy time because we had very limited resources. Yes, we were self-funded and we had a little bit of scratch, but not really that much. And it's kind of amazing when I look back now at the amount of value we were able to create and how much of that has actually scaled. Much of the work we did formed the foundation for our IP, which has now issued, both domestically and abroad. But more importantly, a lot of the realizations and a lot of the algorithms we developed for the benchtop have translated to preclinical and now clinical. And we've been able to tell that story in academic conferences, papers, throughout the course of that development over the last couple of years. So, that's been at Charing Cross, VEITH Symposium, across the board. So it's been a very interesting journey when I think about where we started. And, it's really continued to be a pretty wild ride after that. We've had a lot of major milestones. I think one of the ones I'm really proud of is we demonstrated a fully working and end-to-end system with an in vivo smart vascular implant that automatically alerted us when we crossed that 75% threshold. This was in a couple of animals, but it worked. In addition to that, we innovated a product last year which basically is targeted towards the dialysis space. Now, if anyone's familiar with end-stage renal disease and dialysis patients in particular, you'll know that this is a space that has had pretty much zero innovation for the last 30 years. We developed a product which is going to drastically improve the workflow, improve the peace of mind for patients, and drive down costs, which is one of the most important things that you were hearing about earlier today. And I'll brag a little bit about our team for a second. The first thing I talked to you about with the smart vascular implant, when we started talking to experts in the space for low-power electronics or implantable devices, most people told us it was about a 5 to 10 year horizon to get that done. Or some people very bluntly said, that's not going to happen. We did it in 2 years. for the dialysis product, we started from a drawing on a napkin last September, and we got our first human data back in March. So, pretty amazing stuff, and that's a preview of the product. I won't talk about that too much here, unless someone has any questions. But really, what I want to take a moment to talk about now is our team. Dave and I were really blessed to have the opportunity to start this company, but none of the things we've accomplished since then, especially the two things I talked about, would have been possible without the team we've put together. We've been able to get world-class people to join us, and you'll notice there are probably some familiar initials up there behind some of the names. Many of us were sitting, or many of you are sitting right now, or where many of you would sit when you're not here, which is usually in a dark lab in a corner trying to get your experiments done. But a lot of these people who joined our team, that graduate training was invaluable in terms of preparing them for the rigors of entrepreneurship and actually building a product, because you have to be willing to subject yourself to blind masochism. I kid, but really it's about being on a mission. I think when I look back at my time in grad school, I was on a mission to get something done. I didn't know when exactly it would finish, but I was going to get there. And I think that's what a lot of the folks here have in common. So with that, I'll close. But if anyone has any questions or you would ever like to reach out to us or learn more about what we're doing, we'd be happy to hear from you. My email's up there, and it's also samit@graftworx.com. Thanks a lot.
Hi, my name is Michael Boberg. I'm from Sweden. Thanks for a nice short talk here. Just a quick question about the technology and how it works without disclosing any IP, I guess, but just curious. How does it work?
Yeah, no problem disclosing it. We're using broadband mechanical sensors. So basically, we use a combination of thin film and sometimes off-the-shelf sensor chips, depending on the application. But really, we're looking at combining signals from multiple parts of the frequency spectrum to analyze the signals. And so when you combine things like pressure, flow, you can actually get combinatorial measurements of things like pressure, flow, and eventually percent stenosis, and have a pretty high fidelity with that correlation. And I'm happy to talk offline if you have more questions.